back. The National Income Dynamics Study Coronavirus Rapid Mobile Survey has found that going hungry among adults is higher than children. The data was collected from May to June and it included about 7,000 respondents. Wits Public Affairs Research Institute's Dr. Tracy says while both parents usually suffer, the burden usually falls on women. Leisure further says millions of South Africans are living on the brink of starvation and lockdown has pushed families over the edge. She joins us now live for more. Dr. Tracy Leisure, thank you so much for your time and welcome to ENCA. Quite a disheartening conversation, but it is the reality that we see in South Africa, particularly in households that also have, single mothers or even single parents, where you find the parent or even the adult is willing to starve or go hungry for the sake of their children.
Yes, I think that what this data, which is really shocking and upsetting, I think it confirms what a lot of researchers in this space have been saying for a very long time, that there is a huge food security, fragility and vulnerability in communities, and that to date, the official responses to that have really not been sufficient. So as soon as you get a big external shock like coronavirus and the lockdown and the economic implications of that, millions of families that are literally just managing to keep starvation at bay are going over the edge. And women have got the primary responsibility, even in a two-parent headed household, have got the primary responsibility for feeding children and for making sure that there's food on the table. And they are the people to whom children turn first when they are looking for food. So what we see is that women will eat last. They tend to eat the lowest quality food in the house when there is better quality protein, eggs, fish, canned meat available, then that will go to their children.
Right. But to what extent does also traditional, practices here come to play? Because, you find some instances where you find the women also eat last because they believe that, their husbands or the male in the household needs to eat first, or perhaps the children need to eat first and eat the most nutritious food. And they just were raised or even believe that as women, they need to, yes, cook the food, but eat last and eat whatever that's left to eat.
I think you're absolutely correct. There's a very strong socialization process across multiple cultures that the role of the woman in a household is to sacrifice for other people in the household. And I recall, and this was a couple of years ago, well before lockdown, some research that had been done by Wageningen Research Institute in Bushbuck Ridge, which showed that actually women's dietary diversity can be worse in a male-headed household because women are making sure that the men in the household get access to the best food and the best protein. So yes, it is a traditional role that women have been expected to fill, and it has terrible consequences in a situation of real household hunger.
Yeah. Let's talk about also just some of the psychological consequences. This, or rather food security or food insecurity is brought about to mothers and parents in the household who prefer to starve themselves while, of course, allowing their children to eat. I see here, according to some reports, that, at times they do feel like they're failing to provide for their children if they cannot provide sufficient food within the household.
It puts an almost intolerable strain on women to have children who are crying and upset because they're hungry and asking their mother for food, which food the mother cannot provide. And that is often reflected in increased levels of depression among women and also increased levels of anger. They have this huge helplessness and anger at their situation. And then perversely, that sometimes is vented on the children who they can't help. And this creates this very, very vicious and toxic environment within households.
You mentioned earlier, of course, the impact of COVID-19, and I just want to get into it a bit deeper by just painting a picture on how, devastatingly COVID-19 has sort of like amplified this issue within most households, where before the pandemic and before the lockdown, most families, or at least some, were already having, this issue where, the mother is not eating, if instead, providing for their children. But now that they cannot work, they cannot provide for their children, or perhaps even their salaries have been cut, or those minimum wages that they receive have been cut, it seems it has further just, amplified negatively within the household.
Yes, for a lot of women, this is not a new situation. It's simply made it much, much worse. There's a long history of research documenting the struggles that women face to feed their children. There's a long history of research showing the health implications that women suffer because they don't eat properly so that their children can eat. It's common practice in many places for women to trade sex for food to feed their children or for money to buy food. So this is a situation that women have been in for a very long time. It's largely been invisible, though. It's been an invisible sacrifice that they have made because somehow, against all the odds, millions of these women have actually managed to hold things together. But under the face of the economic shock of coronavirus, they are no longer able to do that. But we mustn't make the mistake of thinking that this is something new. There are millions of South African women, black, poor South African women, who have faced this struggle on a daily basis for decades, for centuries.
Sure. Dr. Tracy Leisure, thank you for talking to us.